All right. Hey, everyone, and welcome back. For today's deep dive, we're tackling a topic that I know can be a little bit intimidating for nursing students. It's pancreatitis.
Oh, yeah. Definitely a challenging one, but also so important. I mean, every nurse is going to see it.
Exactly. So we're going to dive into it using some notes that I have, some textbook
That
excerpts.
sounds good.
But we're not going to just give you the facts, rote and memorization style.
Right. Got to go deeper than that.
Totally. We want to help you actually understand the why behind the what, so you can really apply this knowledge when you're caring for patients.
Absolutely.
So to kick things off, let's start with the pancreas itself. This organ, it always kind of blows my mind that it could do so much.
Oh, for sure. The pancreas is a real workhorse.
Like it's got this double life.
Yeah, exactly. It has both exocrine and endocrine functions.
Yeah, now I remember learning about those functions back in the day. But could you refresh my memory on what they actually do?
Of course. So let's start with the exocrine function. Think of it this way. You just had a delicious meal, maybe burger and fries. Your pancreas is like, hey, it's go time. And it releases all these enzymes like protease, lipase, and amylase.
Those are the big three, right?
Yep. And they break down that food.
Into those tiny little nutrients our bodies can use.
Exactly. So protease takes care of proteins, lipase tackles the fats, and amylase breaks down those carbs.
So basically, without these enzymes, we wouldn't actually get any nutrition from our food.
Pretty much, yeah.
It would just sit there.
Yeah, basically. It wouldn't get absorbed.
Crazy.
Now, switching gears to the endocrine function. This is where the pancreas gets involved in blood sugar control.
Why, yes.
And it does that by producing insulin and glucagon.
Insulin and glucagon.
Yep. These hormones are key players in keeping blood sugar levels stable.
Okay, so 2-in-1 organ, digestion, and blood sugar control. Very impressive.
Very impressive.
But let's talk about when things go wrong. Like when this awesome little organ gets inflamed and we get acute pancreatitis.
Right. So acute pancreatitis, it's not just a little bit of inflammation. It can be really severe.
Like serious stuff.
Yeah, it's basically like the pancreas starts to digest itself.
Ouch. What?
Right. Yeah, we call it autodigestion, and it's as painful as it sounds.
That sounds awful.
Yeah.
So what causes this to happen?
Well, there are a few main culprits. My notes say alcohol, gallstones, and even something called ERCP.
Okay, yeah, I remember those from my notes too. Let's break those down. Starting with alcohol.
So alcohol abuse, especially long-term, is a major risk factor for acute pancreatitis.
Especially in men.
Right. That's right. It's more common in men. It seems like alcohol can mess with enzyme production and trigger inflammation in the pancreas.
Makes sense. Alcohol is definitely not a friend of the body. What about gallstones? Now, I remember those being a problem for the gallbladder. How do they affect the pancreas?
Well, gallstones can actually block the bile duct. And the bile duct is a pathway for both bile from the gallbladder and those digestive enzymes from the pancreas.
So it's like a shared highway.
Exactly. And if a gallstone blocks that highway, well, everything gets backed up.
Oh, no.
Yeah, including those powerful enzymes, which can lead to inflammation and, boom, acute pancreatitis.
So it's like a digestive traffic jam.
Perfect analogy.
Okay. And then my notes also mentioned something called ERCP as a potential cause. That one always sounded a little intimidating.
Yeah, ERCP stands for endoscopic retrograde cholangiopancreatography. It's a procedure they use to diagnose and treat problems in the bile duct and pancreas.
Right, and it's usually safe.
Exactly. But there is a small risk that it can irritate the pancreas and lead to pancreatitis. It's just one of those things you have to be aware of.
Okay, so we've got alcohol, gallstones, ERCP, and my notes also say cystic fibrosis.
Ah, yes, cystic fibrosis.
Less common, but still important.
Absolutely.
So how does that one fit into the picture?
So in CF, you have all that thick mucus, right?
Right.
Well, that mucus can actually obstruct the pancreatic ducts, leading to, you guessed it, enzyme buildup and inflammation.
So a pretty diverse range of culprits, but all leading to that same painful inflammation.
Exactly.
Okay, so let's say we have a patient come into the hospital, and we suspect acute pancreatitis. What signs and symptoms would make us go, this could be it?
Well, the most common symptom is pain. And it's not just any pain, it's sudden, intense abdominal pain.
Oh, so we're talking the really bad kind of pain.
Yeah. Typically, it's in the upper left quadrant. It can be described as a deep, piercing pain that often radiates to the back.
And I think it makes sense if you think about where the pancreas sits. It's right under the stomach. So the pain often feels like it's coming from the stomach area.
Absolutely. Good point.
Okay, so severe abdominal pain, especially in that upper left quadrant. What else should we be on the lookout for? My notes mentioned something about Cullen's and Turner's signs, which sound a little scary.
Yeah, those are definitely important signs to be aware of.
But are they always present?
Not always, no, but they can be a big red flag.
So what exactly are we looking for?
So Cullen's sign is bruising around the belly button, and Turner's sign is bruising on the flanks, the sides of the abdomen.
So basically bruising patterns that could indicate bleeding,
Exactly, bleeding within the abdomen.
which can be a serious complication.
Absolutely.
Okay, those are good ones to remember. My notes also mention jaundice as a potential symptom.
Yep, jaundice, that yellowing of the skin and eyes. It can happen if a gallstone is blocking the bile duct, which, as we talked about earlier, can happen with pancreatitis.
And when the bile duct's blocked, the bilirubin can't get out properly.
Exactly, which is what causes that yellow discoloration.
And what about blood pressure? I saw hypotension as a potential sign.
Right, that's a crucial one. Low blood pressure can be a sign of internal bleeding or ascites.
Which is fluid buildup in the abdomen.
You got it. And both of those are serious complications that need immediate attention.
So it's not just about recognizing the pain, but also looking for those additional signs and symptoms,
Yeah.
like putting together a whole puzzle.
Exactly.
Okay, so we've got those clues. But how do we definitively diagnose acute pancreatitis? I'm guessing blood work is going to play a role here.
Oh, absolutely. Blood tests are essential. The classic findings are elevated amylase and lipase levels.
Ah, those enzymes we talked about earlier.
The very same. When the pancreas is inflamed, they leak into the bloodstream, causing those levels to spike.
Like little alarm bells.
Exactly.
But we're not just checking amylase and lipase, are we?
Nope. We also want to look at the complete blood count, so the CBC.
To check for infection.
Right. And we'll look at coagulation times to see if there are any clotting issues,
Right.
which can happen when the pancreas is really inflamed. And we also need to monitor glucose levels.
Because of that endocrine function of the pancreas.
You got it.
So it's really a combination of the patient's story, their symptoms, and those specific lab values that help us paint a clear picture.
It's all about connecting the dots.
All right, so let's say we have a patient diagnosed with acute pancreatitis. What are our first steps as nurses to help them? What do we do?
Well, think about what the patient is experiencing right now.
Excruciating pain.
Exactly. So pain management is absolutely top priority.
Okay, so what are we giving them?
Typically, we use intravenous pain medications like hydromorphone. It works quickly, and we want to get that pain under control fast.
Makes sense. But my notes mention something about morphine. Is that right for pancreatitis pain?
That's a really good point, because while morphine is a great pain reliever, it's actually contraindicated in pancreatitis.
Why is that?
Well, morphine can cause spasms in the sphincter of Oddi.
Ah, that little muscle that controls the flow of digestive juices.
Exactly. So if it spasms, it can block the flow even more,
Yeah.
and that can actually make the inflammation worse.
Wow, okay. So morphine's a no-go.
Big no-go.
Got it. So pain meds are crucial. What else are we doing to help these patients?
Well, we want to give that pancreas a break. Let it rest and heal.
So nothing by mouth.
NTO, that's right. And we'll also usually insert a nasogastric tube.
And then G2.
Yep, to remove gastric contents and prevent further stimulation of the pancreas.
So giving the digestive system a timeout.
Exactly. And of course, we'll be giving IV fluids to maintain hydration and electrolyte balance.
Okay, makes sense. So we're managing pain, resting the pancreas, keeping them hydrated. What about monitoring? What are we watching closely?
Well, we got to be super vigilant with their vital signs.
Temperature, heart rate, all that.
Yeah, looking for any changes that could signal a problem. And of course, monitoring their pain levels, using a pain scale, asking them to describe their pain.
To make sure those pain meds are working.
Exactly.
Okay, so pain management, rest, fluids, monitoring, anything else?
Don't forget about fluid balance. We need to track their intake and output really carefully. Monitor urine output. Watch for signs of dehydration. Remember, they're NPO and might be losing fluids through vomiting or NG suction.
Right, so staying on top of that fluid balance is key.
Absolutely. And we'll also be monitoring their electrolytes.
Checking those lab values.
Yep, electrolytes can get out of whack pretty easily with pancreatitis.
So it's a whole lot of monitoring and careful management to make sure we're staying one step ahead.
Exactly. Early detection and intervention are so important with this condition.
So we've covered the initial interventions. What about medications? Are there any specific drugs we use to help manage acute pancreatitis?
Well, we've got a few key players. Antacids, for example. They help neutralize stomach acid. which in turn reduces pancreatic stimulation.
So it's all about calming down that stomach acid production to give the pancreas a break.
That's the idea. We also use proton pump inhibitors, or PPIs.
Like pantoprazole.
Yep, pantoprazole is a good example. They block acid production at the source, which provides more long-term relief.
Okay.
And then we have H2 blockers, like famotidine.
Which work in a similar way, but on a different pathway.
You got it.
So a multi-pronged approach to tackling that stomach acid.
Yep.
Okay, so we're doing everything we can to help that pancreas heal.
Yeah.
But now for the scary part, complications. What are some of the things that can go wrong with acute pancreatitis?
Well, one of the most serious complications is ARDS, acute respiratory distress syndrome.
ARDS.
It's life-threatening. Fluid builds up in the lungs, making it really hard to breathe.
That sounds terrifying.
It is. And then we have peritonitis, another major concern,
Peritonitis, yeah.
and inflammation of the peritoneum, the lining of the abdominal cavity.
And that's often caused by infection.
Right. And it can be very serious.
So what are we watching for as nurses to catch these complications early?
We have to be incredibly vigilant, watching for any signs of deterioration, like a high fever, over 100.4 Fahrenheit. That's big red flag.
Okay, fever.
And then rebound tenderness, pain that worsens when pressure is released from the abdomen.
Oh yeah, rebound tenderness.
And then, of course, the classic sign of peritonitis, a rigid or board-like abdomen.
So fever, rebound tenderness, rigid abdomen, those are the alarm bells.
Exactly. If we see any of those, we got to report it to the healthcare provider immediately.
Because these are potentially life-threatening situations.
Absolutely. They require prompt attention, no hesitation.
Okay, so we've covered acute pancreatitis pretty thoroughly. Now let's talk about chronic pancreatitis. How is that different from the acute form?
So chronic pancreatitis, it's more like a long-term battle.
Okay.
It's ongoing inflammation and scarring of the pancreas. And that leads to this progressive destruction and loss of function.
So while acute pancreatitis is like a sudden storm, chronic pancreatitis is more of a slow burn.
That's a great way to put it. And the symptoms of chronic pancreatitis often stem from this gradual decline in function.
So what are we seeing in patients with chronic pancreatitis? What are their symptoms?
Well, abdominal pain is still a major symptom, although it may not be as intense as in acute pancreatitis.
Okay.
But a big part of the picture is pancreatic insufficiency.
Which basically means the pancreas isn't producing enough digestive enzymes.
And hormones, too.
Right. Which leads to a whole bunch of problems.
Yeah, exactly. Like, imagine not being able to properly digest your food.
Oof, yeah.
You see a lot of digestive issues, malabsorption, weight loss, even though they're eating enough,
Makes sense.
often constipation, and then something called steatorrhea, which is excess fat in the stool, giving it this greasy appearance.
Oh, wow. Okay, so digestion is definitely a mess. What about those hormones? What happens on that front?
Well, since the pancreas is also responsible for making insulin, damage from chronic pancreatitis can lead to diabetes.
So chronic pancreatitis can actually cause diabetes.
It can. It's often called type 3C diabetes or pancreatogenic diabetes. And it's caused by damage to those insulin-producing cells in the pancreas, not an autoimmune response like in type 1 diabetes.
Gotcha. Wow, that's a lot to deal with. So how do we manage chronic pancreatitis? Is it similar to the acute form?
Well, the treatment approach is definitely different because we're dealing with long-term damage. During acute flare-ups, the treatment is similar to acute pancreatitis, focusing on pain relief, resting the pancreas, supportive care. But long-term, it's much more multifaceted.
So what are some of the key strategies we use to help these patients?
Dietary modifications are crucial, usually a low-fat diet to reduce the workload on the pancreas.
I had low-fat diet.
And we often prescribe pancreatic enzyme replacement therapy.
They're brute.
Exactly, to help with digestion and nutrient absorption.
And then, of course, managing diabetes if it develops.
Absolutely. That's a key part of the picture.
So it's a lot of lifestyle changes, medications, and managing those potential complications.
Exactly.
Now, there's one more topic I want to touch on, and it's a tough one. Pancreatic cancer?
Yeah, it's a tough one for sure.
So how does that fit into all of this?
Well, unfortunately, pancreatic cancer is often diagnosed late, when it's already spread.
And it's partly because the early symptoms are so vague.
Exactly. They can mimic other conditions, like chronic pancreatitis.
So it can be hard to catch it early.
It really can.
How is pancreatic cancer typically diagnosed?
Well, CT scans are the most common imaging test used. They can visualize the pancreas and look for any tumors. But often, by the time it's diagnosed, surgery isn't an option.
Oh, wow. What about radiation and chemotherapy? Are those possibilities?
Sometimes, yeah, but they're often palliative. meaning the goal is to relieve symptoms and improve quality of life rather than cure the cancer.
So in those cases, our focus as nurses shifts to providing support in symptom management.
Absolutely. We focus on making sure the patient is as comfortable as possible, managing pain, ensuring they're getting enough nutrition, and addressing any other symptoms they're experiencing.
Right. And I imagine emotional and psychological support are really important too.
They're crucial, both for the patient and their loved ones. It's a very difficult journey.
It sounds like it. Well, this has been a really eye-opening deep dive into the world of the pancreas and pancreatitis. From those basic functions to the complexities of acute and chronic pancreatitis, and even this tough topic of pancreatic cancer.
It's a lot to take in.
It is. But before we move on, I want to make sure we highlight some practical takeaways for our listeners, especially those nursing students who are going to be facing these conditions in clinical practice.
Yeah, that's a great idea. Let's break it all down and really emphasize what's most important for them to remember about pancreatitis.
Exactly.
So when we're thinking about key takeaways for nursing students, one of the first things that comes to mind is recognizing the signs and symptoms of pancreatitis. Catching those early cues, that can make such a difference in getting patients prompt treatment and, preventing complications.
That's so important. And I remember in nursing school, I felt a little overwhelmed at times, just with like the sheer number of signs and symptoms
Yeah, totally.
for all the different conditions.
Yeah.
Is there a way to make remembering those key signs of pancreatitis a little easier? Like any trick?
Oh, absolutely. Mnemonics can be super helpful for memorization.
Love a good mnemonic.
For example, remember how we talked about the location of pancreatic pain?
Yes.
Well, there's a mnemonic for that.
Okay.
NCLEX, tip pain.
I love that one. NCLAX, tip pain.
It helps you remember that the pain is often in the epigastric region or the left upper quadrant.
Right, it's like a little mental map.
Hmm.
Are there any other mnemonics for pancreatitis that you use?
Well, to remember the causes of pancreatitis, you could try GET SMASHED.
Get smashed.
It stands for gallstones, ethanol, trauma, steroids, mumps, autoimmune diseases, scorpion stings, hypercalcemia, hyperlipidemia, ERCP, and drugs.
Ooh, that's a mouthful. Get smashed.
I know, it covers a lot of ground.
But scorpion stings. That's a new one for me.
It's not that common, but yeah, scorpion venom can actually trigger pancreatitis in some cases.
Huh, interesting. Okay, well, I'm adding that to my mental nursing notes. So we've got our mnemonics
Right.
to help us remember those important signs and causes. But once we suspect pancreatitis, what are the crucial nursing interventions that we need to prioritize?
Well, as we said earlier, pain management is always at the top of the list. We talked about IV pain meds like hydromorphone.
Right, and remembering that morphine is a no-no.
Absolutely, got to avoid that morphine trap.
For sure. But sometimes those meds aren't enough, especially when the pain is really severe. Are there any non-pharmacological approaches we can use?
Yeah, for sure. Positioning can make a big difference. Helping the patient find a comfortable position, often leaning forward or in the fetal position, can help relieve some of that pressure on the pancreas.
Oh, that makes sense.
And we can use relaxation techniques too, like deep breathing exercises or guided imagery, just to help them cope with the pain.
Right. Sometimes just creating a calm, supportive environment can go a long way.
It really can.
But beyond pain, what other nursing diagnoses are we commonly seeing in patients with pancreatitis?
Well, deficient fluid volume is a big one. Remember, these patients are often NPO, and they might be losing fluids through vomiting or that NG suction. So monitoring intake and output, assessing for signs of dehydration, and administering 5E fluids, those are all crucial interventions.
So it's not just about giving them fluids, it's about really carefully tracking and adjusting those fluids.
Exactly. You want to keep them in that sweet spot.
And speaking of balance, I know imbalanced nutrition, less than body requirements, is another common diagnosis.
Absolutely. If the pancreas isn't working properly, they're not going to be absorbing nutrients effectively.
Even if they could eat.
Exactly. So that's where pancreatic enzyme replacement therapy, or PERT, comes in. We give them meds that contain those essential digestive enzymes to help break down food and improve nutrient absorption.
So we're giving their digestive system a little boost.
Exactly, like providing a backup crew.
And I'm guessing once they're able to eat again, dietary modifications are going to be key.
Absolutely. We usually start them on a clear liquid diet and then gradually progress to a low-fat, high-protein diet as tolerated. And of course, we got to educate them about avoiding foods that can trigger the pancreas, like fatty foods, alcohol, caffeine, all the good stuff.
So it's not just a temporary change, it's really a long-term lifestyle modification.
It is. And speaking of long-term management, let's talk about chronic pancreatitis. What are some key things nursing students should know about managing that condition?
Well, I know you mentioned pain is still a factor,
Yeah, it is.
but it might not be as intense.
Right, and unlike acute pancreatitis, which often resolves, chronic pancreatitis is progressive.
Right.
So it's all about slowing down that progression and managing the complications that can arise from the pancreas, kind of losing its ability to function as well.
So it's like we're playing the long game here,
Exactly.
trying to preserve as much pancreatic function as we can.
Absolutely. And a big part of that is managing those complications, like diabetes, which, as we talked about, can be a common consequence of chronic pancreatitis. So educating patients about monitoring their blood sugar, making healthy food choices, and potentially taking insulin or other diabetes medications, those are all important.
So basically managing it like any other type of diabetes,
Yeah.
but with that added layer of complexity from the pancreatic damage.
Exactly. It adds another dimension for sure.
And let's not forget the emotional side of things, too.
Mm.
Chronic pancreatitis can really take a toll.
Oh, absolutely. They're dealing with chronic pain, lifestyle changes, and just the uncertainty of a progressive disease. That can be a lot to handle.
That's a really good point. It's easy to get so focused on the medical management that we forget about the human side of things.
Yeah.
What are some ways we can provide emotional support for these patients?
Well, just taking the time to listen can make a world of difference. Really listen to their concerns, fears, frustrations. We can also offer education and reassurance. Explaining their condition in a way that they can understand and helping them feel more in control of their care.
And sometimes just being present.
Absolutely. Sometimes that's all it takes.
Offering a compassionate, supportive presence can be the most powerful intervention of all.
It really can be. It's about treating the whole person.
Right, not just the disease.
Exactly. And that human connection, that's what makes nursing so rewarding.
Well said. Now, before we wrap up this deep dive, I want to touch on research. What are some of the exciting new things happening in the world of pancreatitis treatment and care? What should our listeners be looking out for in the future?
Oh, there's so much exciting research happening. It's constantly evolving our understanding of pancreatitis.
Ooh.
One area that's really promising is early detection. Researchers are looking for new biomarkers and imaging techniques that can help us identify pancreatitis sooner.
So we could potentially catch it before there's a lot of damage.
Exactly. That would be a game changer.
What else is on the horizon?
Well, there's a lot of interest in developing new therapies for chronic pancreatitis. Right now, the treatments mainly focus on managing symptoms,
Right.
but researchers are looking for ways to actually halt or even reverse the damage to the pancreas.
That would be incredible. What kind of therapies are they looking at?
Some promising avenues include stem cell therapy, gene therapy, and even new medications that target specific inflammatory pathways.
Oh, that's really exciting.
It is. It's an exciting time to be in the field for sure.
So much potential.
Yeah.
But where do nurses fit into all this?
Right.
What role can we play in research in advancing our understanding of pancreatitis?
So nurses are essential to research. We're at the bedside, observing patients, collecting data, noticing patterns.
Right.
We can participate in research studies, share our observations with researchers, and help translate those research findings into actual practice.
So we're not just caregivers, we're also researchers in a way.
In a way, yes. We're an integral part of the process. Our insights are really valuable.
That's amazing. Okay, so we've talked a lot about the complex world of pancreatitis.
We have.
But what are the main takeaways that our listeners, especially those nursing students getting ready for clinicals, should really remember about pancreatitis?
Well, first and foremost, pancreatitis is serious. It demands our attention.
Yes.
Early recognition and prompt treatment are key to improving patient outcomes. And understanding the pathophysiology, the why behind the what, that's what's going to make you a more informed and effective nurse.
Right. Know your signs and symptoms and the reasons behind them.
Exactly.
What else should they keep in mind as they prepare to care for these patients?
Pain management is paramount. These patients are often in excruciating pain, and we need to be proactive, aggressive even, in addressing their discomfort. And never forget, morphine is off the table in pancreatitis.
Avoid that morphine trap. What else is crucial?
Monitoring, monitoring, monitoring.
Can't say it enough.
I know. We need to be constantly vigilant, assessing vital signs, fluid balance, electrolyte levels,
Right.
and always watching for any subtle signs of complications. Early detection and intervention, that's key.
Be those vigilant guardians of patient safety. Anything else that's particularly important for nursing students to grasp?
Remember that nursing care goes beyond the physical aspects of a disease.
Yes.
Addressing the patient's emotional needs, providing support and education, being an advocate for their well-being, those are all essential parts of holistic nursing care.
That's such a great point. We're caring for a person, a whole person, not just a condition.
Exactly. And that human connection, that's what makes nursing such a special and rewarding profession.
Well said. And on that note, I think we've successfully navigated this deep dive into the world of pancreatitis.
We did it.
I hope our listeners, especially those future nurses out there, feel more confident and prepared to tackle pancreatitis in their clinical rotations. Remember, keep learning, keep asking questions, and never underestimate the impact you can have on your patients' lives. Until next time, happy nursing.
You know, it's amazing to think about everything we've talked about today. I mean, the pancreas is such a tiny organ, but it plays such a huge role.
It does, from digestion to blood sugar control, and when things go wrong, well, we see just how big of an impact it has.
Right. It's like this tiny but mighty organ. And speaking of impact, let's talk about how all this knowledge actually translates to real-world nursing. You know, put ourselves in the shoes of a nursing student. They're about to start their clinical rotation. What are some things they can take with them to care for patients with pancreatitis? Well, I think one of the most important things to remember is that every patient is different.
Oh, for sure.
We've talked about the general signs and symptoms, interventions, all that, but you have to individualize care, you know, based on the patient's specific needs and how they present.
Right. There's no one-size-fits-all approach. So what are some things a nursing student could do to really personalize care for a pancreatitis patient?
I think the first thing is just to listen. Really listen to your patients.
They go their body's best.
Exactly. Ask them about their pain. Where is it? How bad is it?
Right.
What makes it better or worse? That information is going to help you figure out the best pain management strategies, whether that's meds or, you know, some of those non-pharmacological things we talked about.
Right, like repositioning or just helping them get comfortable.
Exactly. And just clear communication goes a long way. Explain procedures in a way that they understand, answer their questions, offer reassurance and emotional support, just little things that can really make a difference in their experience.
Right, sometimes it's those little things that have the biggest impact. So when it comes to monitoring pancreatitis patients, what are some things a student should be super vigilant about?
Well, those vital signs are so important.
They're like our window into what's happening.
Exactly. So be really diligent about checking their temperature, pulse, blood pressure, respirations, and any changes, any significant changes, report those right away.
Because those changes could mean something's going wrong.
They could be early warning signs of complications. And remember those lab values we talked about. Amylase, lipase, electrolytes, those are all crucial pieces of the puzzle.
Okay, so stay on top of those labs.
Definitely. Be ready to report any weird results.
Got it. Be a lab detective. But what happens when things do take a turn for the worse? And we suspect a complication, like ARDS or peritonitis. What should a nursing student do in that situation?
Communicate immediately. Don't wait.
Call the doctor.
Yes. Notify the healthcare provider right away about any concerning signs. Those red flags we talked about, high fever, rebound tenderness, a rigid abdomen, those need immediate attention.
Okay, so clear communication is key. But is there anything else a student can do in those moments besides calling for help?
Well, depending on the situation, they might need to help with oxygen, positioning the patient, maybe even prepping for some kind of emergency procedure. You have to stay calm. Prioritize what needs to happen first, and follow the doctor's orders.
It sounds like it can be really intense.
It can be, but even in those stressful moments, remember the human element.
Right, they're a person going through something scary.
Exactly. Providing emotional support to the patient and their family during a crisis is huge. Sometimes a calm, reassuring presence can make all the difference.
We're not just treating a disease, we're caring for a human being.
That's what it's all about.
Well, I think we've covered a lot of ground today. This deep dive has been a whirlwind tour of the pancreas and everything pancreatitis.
It has. But it's such an important topic for nurses to understand.
I hope our listeners feel more prepared to tackle pancreatitis in their clinicals.
Me too. Remember, never stop learning. Keep asking questions.
And never underestimate the impact you can have on your patients' lives.
Well said.
Until next time, everyone, happy nursing.